Hello, shall we start?
Yes, we can start.
Okay, Swarnasri ma'am, are you there? Swarnasri ma'am? Shubha ma'am?
Yes, ma'am.
Okay. Can we start the section, ma'am?
Yes, ma'am. Ma'am, what about Swarnashri, ma'am?
Darshana, unmute the mic. Sorry, mute the mic.
Shall we start? Swarnasri ma'am, are you there?
Yes, ma'am, you start, ma'am.
Very good afternoon, everyone, and welcome to this revision section of your upcoming exam. My name is Savina, and I will be your host for today. We are here to ensure that you feel confident and prepared as you tackle these important subjects. Throughout this interactive section, we will revisit key concepts and address any questions you might have. Before we begin, let's go over a few quick guidelines. Please keep your microphones muted unless you are asking a question to avoid background noise. Feel free to use that chat feature to post your queries or thoughts during the section. We encourage active participation, so don't hesitate to speak up if you need clarification. Thank you all for being here, and let's make this a productive and insightful section. Without further delay, let's dive into the topics.
Good evening, all. Today, me and Swarna ma'am is going to discuss about mental health nursing. So, in this video, we are going to discuss regarding some important questions for your examination and how to write the exam, and few tips we are going to give which will help your exam. And as you all know, your exams are near. So, when you are going to attend your exam, first thing you need to know about the syllabus. After getting to know about syllabus, then focus on important questions. So previous 10-year question you can focus, and so many questions will repeat from previous year question paper. So in this video we are going to give some important questions and some important tips which will help you to get passed in your examination. So coming to the syllabus, according to the IMC syllabus, you have. So first, let us know what is mental health nursing. So I think all of you know what is mental health nursing. Mental health nursing is nothing but it is a subject which is going to treat with only mental illness peoples. So in this subject you are going to learn what are the treatment we are going to give for mentally ill patients, and what are the behaviors we are going to see by mental illness patient. So this subjects only deals with the care of mental peoples. So coming to the syllabus, the unit 1, ma'am change the unit first is introduction. So in introduction you are going to study about the what is the meaning of mental health and what is the meaning of mental illness. So these are the two important topics you need to study for 2 marks question. So in this chapter they will ask for 2 marks question: define mental health and define mental illness. So the meaning of mental health is different and the meaning of mental illness is different. So you need to know the difference between mental health and mental illness. Then the misconceptions related to mental illness. What it indicates means so many people don't know that mental illness can be treated. So what they are doing before previous generation peoples and before days, what we are seeing, everybody used to torture the mental patients. If they see any mental person, they used to throw the stones and they used to burn on the fire, and they used to put in one room and they used to lock them. They used to not allow them to enter other outside. So nowadays the mental illness scope is going to get increased, and the advanced technology also increased. We have so many types of medicines to cure the mental diseases. So in this chapter you are going to study regarding what are the misconceptions people are going to think about them. Not every mental person is going to cause injury to the peoples. Okay, so we need to guide them properly and we need to provide treatment to overcome from these diseases. And next one is the important thing, principles of mental health nursing. So this is very much important question for your examination, that is for 3 marks. Sometimes they will ask for 5 marks. Define mental health and write the principle of mental health nursing. Or sometimes they will ask directly for 3 marks, write the principles of mental health nursing. So you know the meaning of principle. Principle is nothing but rules and regulations. So as a psychiatric nurse, what are the rules and regulation you need to follow while you are treating the mentally illness people? Because we are providing treatment to mental patient means it is not a easy job, because it is very risky job. We are in the risk position. When we are going to give any medicine, when we are going to give any treatment, there is a chance of doing harm for nurses and doctor. So it is very risky job to take care of the psychiatric illness people. So you need to follow some rules and regulation as a psychiatric nurse and as a psychiatric doctor. So in this chapter you are also going to study how to deal with the mentally illness people. And next one, you are going to study the definition of terms in psychiatric. For example, attention, memory, perception. So these are the things you are going to study in the psychiatric subject, right? So in this subject you are going to write like what is the meaning of attention, what is the meaning of perception, what is the meaning of memory. So you can expect the question for 1 marks. You all you know that in your question paper the first main is give the meaning of following. So you need to write 1 line or 2 line answer. Okay, so for this type of question you can accept the question from this chapter, that is like the terms attention, memory, perception. And the next thing is review of defense mechanism. So here you need to know what is the meaning of defense mechanism. And next one, mental health team. So in mental health team there are so many doctors, nurses and psychiatrists. Everyone is going to work to cure the mentally ill people. So in one team, how many peoples, how many like whether doctor will come or whether nurse will come or whether psychiatrist will come. So these things you are going to study in this chapter only, that is in the topic mental health team. So what question they ask, like which are the person works under mental health team. So you need to write doctors, psychiatrist, then psychologist and psychiatrist, nurse and pharmacologist. So these persons are going to comes under mental health team. And the next one, Swarnasri ma'am.
Okay, ma'am. Uh, in the first unit itself, we are going to discuss about this introduction and all. Am I audible?
Yes ma'am.
Yeah, in that unit as well, we have to know about this mental health team members, right? Most probably, they are going to ask for a 3 marks questions along with their functions. Okay, if it comes to the psychiatric nurse, we have to know about the psychiatric nurse roles and responsibilities also. For that reason, you have to remember all the things like who are present in the psychiatric team. You have to know with their roles and responsibilities also. Make sure it will help to get a good marks in this particular question. Okay, the next unit by itself, we are going to study about the history of psychiatry. Already ma'am told that in the previous ancient era in India, it was like how it will be there, in for a mentally ill peoples, they are not at all getting a proper treatment. Some kinds of myth will be there in that and all. So for that reason the mental health program has been arised. Okay, then after we will get the treatment for the mentally ill peoples, then after we will get the treatment for the
You can continue the section for network issues only.
Unit number 2, it is about the history of the psychiatry. Okay, in this unit mainly we are going to study about this national mental health program. Okay, for that program we have to include all the objectives, principles and factor influencing the mental health. These are all the things we need to include in this particular unit while writing the examination. Okay, that is only the important question we can expect from this unit. Okay, this is all about the second unit. Over to third unit, Shubha ma'am.
Ma'am, PP.
I think it's not opening. You just open in your phone, ma'am.
Okay, the unit 3 is mental health assessment. So here in the term only is there health assessment. Here we are going to assess the patient, that is mental illness patient. So how we are going to assess? By asking questions, by doing counseling. You all know if there is any psychiatric patient means first we are going to do the counseling sessions for them. So in the counseling session only we will come to know that the patient is having any mental illness or not. So how we are going to do the assessment? So one is counseling, next one is history taking, psychiatric history taking. It is nothing but you need to take the patient details. For example, you need to ask the name, you need to ask the place, because if the person is mentally well means if you are asking any question, for example if you are asking his name, he will able to tell his name. If you are asking the place where you are, then he will tell the correct place name. But if he is mentally ill, if you are asking name, he will give some another answer, some other answer he is good, he is going to give. So then only you will come to know, oh, this person is not mentally well. So if you are asking some question means if he is able to give the correct answer, then you will identify that he is a psychiatry well. If he is not answering correct, then you will come to know he is not psychiatric well, he is a psychiatric patient. So this thing you are going to do for the assessment. One is you are going to do by observation, and next one counseling you will do, and the next thing you are going to take the history of the patient, and the last thing you are going to do the mental status examination. How you are going to do the mental status examination is by first one, observation. You need to first observe the patient. If one patient is able to sit in one place at least 5 to 10 minutes, if he can't able to sit in one place, then if he want to roam and if he is going to do any harmful or injury to other peoples, then also you can recognize that he is not mentally well. The next thing you will ask some questions. I given some example also, like name you will ask, place you will ask, or father name, mother name. So some of the detail you are going to ask. So by asking question also you will come to know whether the person is psychiatric well or not. And the last thing is interview. Everyone know what is the meaning of interview. Interview is also like same, we will ask some questions and we will expect some answers. So by doing interview also we will come to know what is the mental present behavior of the patient. So these are the things you are going to study in mental health assessment, that is unit 3. So in unit 3, the main important question is mental status examination. And the next is unit 4.
Unit number 4, we are going to study about the therapeutic nurse patient relationship. Yes, no, in the hospital session, we have to maintain this therapeutic nurse relationship because we are going to give a treatment for the patients. Yes or no? So, for this reason, we are using certain therapies. Okay, like when it comes to this psychiatric patients, we are going to give this like ECT, okay, ECT and all. Then play therapy will be there, music therapy will be there, and for that reason, it should be having some skills. For example, nurse should well trained in this field, and then after she has to maintain some therapeutic nurse patient relationship with the patient. She should not give up cell phones to these patients like that. Only nurse patient therapeutic relationship should not maintain any kind of personal relationship with the patient. That is what we are going to study in this unit. The next one is the communication skills. That is also very important in the nursing field as well. We have to maintain proper communication skills. Then after here we are going to study about the barriers of the therapeutic relationship with nurse and patient. So these are all the important questions, and again we are going to study about these factors influencing the communication. Yes or no? If the doctor is telling one thing, the nurse is not understanding. If nurse is going to tell some other things to the patient, again it will leads to the complications. For that reason, we have to maintain a proper communication skills as well. Okay, these are all the things we are going to study in this unit. When it comes to this therapeutic nurse patient relationship, here we can expect the 3 marks type of questions, and they will ask regarding the factors influencing the communication, type of communications, and role of nurse in this therapeutic nurse patient relationship. These are all the questions we can expect from this unit. Over to fifth unit.
Ma'am, your mic is off.
Sorry.
Okay, ma'am,
Okay,
shall I
sorry,
continue
sorry.
this unit? Hello.
Okay, ma'am. Okay, okay.
Okay. You will continue or I will continue, ma'am?
As Swarnashri ma'am told, right? So, nurse-patient relationship. If the nurse-patient is maintaining a good relationship, they will follow the what the nurse is going to tell. So, especially for psychiatric ill patient. So, if the patient is having psychiatric illness, means first you need to maintain some good relationship with them. If you are maintaining a good relationship with them, they will obey your orders. For example, if you want to give any medicine, if you want to give any drugs, if you are having good relationship with that psychiatric patient, he will obey your words, he will respect your words. So this is the thing very much important in unit 4, that is therapeutic nurse patient relationship. And coming to the unit 5, the mental disorder and nursing intervention. Swarnashri ma'am, you can continue, ma'am.
Okay. In this unit, mainly we are going to expect the long answer type of questions. Am I audible properly?
Yes, ma'am.
Okay. In this unit, mainly we are going to expect the long answer type of questions. Here we are going to study about the mental disorders and the nursing interventions. Means what and all the management we are going to do for this mental disorders. Here we are going to classify the mental disorders. Okay. Here we are going to classify the mental disorders like disorders of thought, disorder, motor activity, perception, mood disorders, speech disorders, memory, concentration, various mental disorders we are going to classify under this. Okay, personality disorders like then organic mental disorders, delirium, dementia, like these kind of disorders we are going to study under this unit. Mainly how you need to answer for this questions means you have to write the definition of the particular mental disorder. Okay, then after you go towards the etiology, which means causes. Then after you move towards the signs and symptoms. After that you move towards the nursing management. in that management also, medical management, and what are the interventions done by the nurses. These are all the things you have to write, and two care plans should be right in the answer booklet. Then after you move towards the health education, what and all the health education you have to give to the patient, that patient or patient guardians, that you have to mention here, and you have to wind up your answer. Okay, that is the thing we are going to study in this unit. If we can't able to tell each and every disease condition in this session because the time is very less, for that reason you just how you need to write the examination, in the examination the answer, that is what I'm going to tell regarding this unit. See, first you mention, you just write in one book all the mental disorders, okay, according to that classification. Then you should write all the definitions of that. If you know the definition properly, you can able to elaborate the answer, right? Understood what I'm telling? Okay. Avina ma'am, can you change the slide? The next one is, here we have certain disorders. Again, this all disorders will comes under this unit only. Okay, most probably the long essay which will be arises from this unit, and they can ask for 1 mark, 2 mark, meaning everything from this unit. There is a must much chance to expect the more questions from this unit. Okay, for your kind information, I'm telling no need to skip this unit. Okay, this is the one of the scoring units. So for that reason, you have to answer each and every disease condition. Only the tip is you make one list of the psychotic disorders, one book, and then after you accordingly you just study about that. Okay, next unit, sixth unit, ma'am.
See, in unit 5, you need to give more importance on schizophrenia. They will ask for 2 marks what is schizophrenia and what is eating disorder like anorexia nervosa. So, you know the meaning of this. Like the person will be having more tendency to eat, and some persons will be have more tendency like not to eat the food because they are planning to do the diet. Okay, what they are going to do, they will not eat the food. So these are the disorder which is related to eating. Some person will eat more and some persons will not eat the food. So in this fifth unit you need to study what are the eating disorder like anorexia nervosa. So many disorder will come like schizophrenia you need to write, and hallucination, so perception. So you need to know the meaning. If you know the meaning only, then you will understand what to write. So if they ask what is the characteristics of schizophrenia person, if you know the correct meaning of schizophrenia, you can write by your own sentence. Okay, when we are correcting papers, nobody will expect the answer as it is in the textbooks. So whatever you know what are the characteristics present in the mental patients, so according to the disease condition. For example, if the patient is having depression, the characteristics is different. If the patient is having schizophrenia or memory loss, the characteristics will be different. So if you know the correct meaning of the definition, you can write the answer by yourself. Okay, then coming to the unit 6, the psycho and social therapies. So therapy is nothing but treatment. So what are the treatment we are going to give for the psychiatric patients? So one is psycho and social therapies. So we are going to give the social therapies. Social therapies like including laughing exercises, then involving with other peoples. You all know if any person is having psychiatric illness means they used to do the separation, they used to need the isolation. But we should not do the isolation, because if you are doing isolation again it will cause drawback to him. Again he will go for loneliness, again he will move for depression. So when the person is having psychiatric illness, you need to start the therapies. Like behavioral therapy is there. Behavioral therapy is nothing but changing the behavior of patient. So some of the students in college, students and school students need behavioral therapies because they don't know how to behave in the society. some students will be there, how they are behave in the houses, exactly they are going to behave in the school also. So they need some changes. They need to know how they want to behave in society, how they need to behave in houses. So here we are going to focus on changing the behavior of the patient. So that is also one of the therapies. Next, the psychopharmacology. You all know the meaning of pharmacology. Pharmacology is nothing but the study of medicines. It is related to drugs. So what are the drugs we are going to use for the psychiatric patients? So you need to be very careful while you are giving medicine to the psychiatric people, because psychiatric medicines are very made up of like drugs. It will be like more chemicals and it will be seductive also. So if you are giving more medicine or more dosage, there is a chance of death also. So you should know how much dosage we need to give and what is the right medication to given for the psychiatric patient. So like some of the medicines are there, antipsychotic. Anti means against. So against psychological problem we are going to give some medicine. And antidepressant, anti is nothing but against. So against the depression we are going to give the antidepressant medicine. If any patient is having depression, you need to give the antidepressant medicine. And next one, anti anxiety agents, or so many types of medicines available for the psychiatric patients according to their disease conditions. And next one, psychosocial therapy. One is individual therapy. Individual therapy is nothing but counseling. Okay, so this person will not need any drug or not behavioral therapy or psychosocial therapy. These persons or this psychiatric patients needs only individual therapy, means counseling. We need to take 2 to 3 counseling sessions, then we can reduce the mental illness. Next one, group therapy. Group therapy means here we need to join more peoples, like 2 to 3 peoples we need to join, and we need to make them sit and we need to give laughing practice. So if they have so many problems, they need to forget them and they need to adopt the new style and they need to interact with the society. So if the patient is having depression or loneliness problem, the patient will not mingle with the society peoples. They will sit in one room and they used to cry. So they have some depression issues. So to overcome this, we need to give the group therapy. And next one is behavior therapy. As I said, to change the behavior. Next one, occupational therapy. Because of stress, nowadays we have more stress in working places. Like we have more stress from seniors torture. If IT company workers, they need to work for more hours. Because of this, that persons are getting more stress and it is going to turn as a psychiatric disorder. So for this person, you need to give the occupational therapy. And family therapy. Family therapy will be given for the family person, like husband and wife is going to get fight. So because of that, husband got depression, or because of that, wife maybe get depression or loneliness. Maybe it turns to suicidal tendency also. So for this, you need to give the family therapy. So next, the role of nurse. So as a psychiatric nurse, how you are going to take care of them, how you are going to solve the psychiatric problem, and how you are going to use the therapies. First, you need to know what is therapies, how you can do that. Everything first you need to know. If you know only, you can provide to treatment. Okay, next one, electroconvulsive therapy. Electroconvulsive therapy is nothing but giving electric shocks. Maybe you all seen in movies. So if any person is having mental illness, they will take to one room and they will give the mental shock treatment. So this treatment also we are going to use for the psychiatric patient. Next one, insulin. We will give the insulin and we will reduce their activities. And next one, role of nurse in this therapy. As a nurse, what are the things she need to carry out? So these are the topics you are going to study unit 6. In this unit 6, the main thing is you need to know which are the medicine used for psychiatric patient and what are the therapies. Without knowing therapies, You can't provide any treatment for the psychiatric patient. For psychiatric patient, we will mostly give the therapies only. Okay. So in this chapter, you need to most focus on therapies topic and medicine, psychopharmacology topic. You need to give attention. The next chapter, Unit 7, Swarnasri ma'am.
Okay, okay, I will carry it out. Unit number 6, we have discussed about this therapies and all, right? Whichever therapy you written also, you have to write the roles and responsibility of nurse in
Nurse.
particular therapy. Okay, that no need to forget in the examination. You just carried out that as a tip. The next unit is community mental health. Yes, no. In the community means what? A group of people present in a or live in a geographical area. Yes or no? In the community people, how the mental health will affect, whether a mentally ill patient is present in the community people, they are the I'm sorry, the atmosphere will be good there. No, right. For that reason, we have to study about this community mental health also, while giving the proper treatment for the people as well, and to reach out the group of people. That is the main intention of the community health nursing. The next one is, here we are going to study about the concepts are nothing but the ideas, then importance of the community mental health, then scope, then attitude, sigma, and the discrimination related to the mentally ill patients, and the prevention of the mental illness, then preventive care for the psychiatric patients during the childhood, adolescent, and adulthood. See why? Because in the community we can see the mentally retarded children. Yes or no? For that and all, we can't able to send to the hospitals to take the treatment and all. For that reason, we can able to educate the people while providing health education regarding this mental health. We can able to curb the mental illness in the community. That will be very helpful for our society as well. Yes or no? If in your home somebody is not well in their mental status, whether the neighbor will come to your home, you keep on disturbing him, whether the one person is keep on disturbing from your home, whether the neighbor will come to your home. No, right. For that reason, we have to provide a proper health education regarding this mental illness in the community. Otherwise, one of the drawback is the people will think that that person is different from other person. That will leads to what? They can treat them in a very bad manner like that, which means they can isolate them, they will harm them, they will simply going and beating them. Like these kind of activities will be done by the community people. For that reason, to curb this and all the things, we are going to give a health education under the national mental health program. Okay, again, if they'll ask the question from this unit, you can merge with the answer, like national health program, include those points too, and you can able to get the good marks in this. Okay, you just concentrate regarding the concepts, importance, and the scope of community mental health, and the roles and responsibilities of a community health nurse. In that, you can add the common points like a health educator, guider, rehabilitator. Okay, like this kind of common and specific points you can include in the role of community health nurse. Understood? We can move with the next unit.
The unit 8 is psychiatric emergencies and crisis intervention. So, some because of the psychiatric illness, so many patients are going for suicide, or they are going to take the poisons. They are going to do any injury to other peoples because of their illness. So, at the time, we need emergency treatment. So what are the emergency treatment, what are the emergency medication we are going to use for the psychiatric peoples? Okay, that we are going to study in this chapter only. And next one, types of psychiatric emergencies. As I told, there is suicide, poison, injury, accident. So these all the types of psychiatric emergencies. So they don't know that is a poison. Okay, because they don't have that capacity to judge. They don't have any idea to recognize whether it is a poison or whether it will cause harmful to our body or not. So what they will do, they will take that poison and they will drink. So there is a chance of getting suicide also because of loneliness and depression. So these types you need to study. And overactive, so overactive usually present in the small children's. So you can see some children's, they will not sit in one place, they wants to roam. If the parents will tell to sit one place, they used to run, they used to walk, they will not sit in one place and they will not listen anything because of this overactive disorder. So this overactive disorder can be also seen in, especially in the children's. And underactive patient, so underactive means they are very lazy, they are lack of interest, they don't have any interest to survive, they don't show any interest to read, they don't show any interest for living. So this patient also we can see. And violent behavior, so we have behavior like polite behavior and another one is violent behavior, right? So polite means it will be in the good manner, violent means it is not in the good manner, it will be in the bad manner. That behavior will cause like disturb, it will disturb to other peoples. And next one is suicide adverse drug reaction. When the psychiatric patient is going to attain suicide, what are the adverse reaction it is going to take place? And the next thing, withdrawal symptom. Withdrawal symptom is nothing but like alcohol, drugs. Okay, one person is going to addict. Now if one person is addicted to alcohol, then that person may be addicted to any drugs, he cannot overcome with that, it needs some time and it needs some treatment. So you people all know there are so many rehabilitation center. Why we are going to establish rehabilitation center? To withdraw the symptom like alcohol or any drug. So next, crisis and intervention. So in crisis and intervention, they will ask define crisis and intervention and what is the purpose. And the next one, adolescent crisis. What are the changes? What are the things the adolescents peoples are going to get adopt? And next one, AIDS. So what is AIDS? You all know it is acquired immune deficiency syndrome. So you are going to study regarding AIDS also. Some peoples are more interested in the sexual things, so that is also we need to do the withdrawal. Okay, so these are the things you are going to study in chapter 8. And the next,
Woman, you continue this chapter also. Here, this namaz is going on.
okay, in Unit 9, the forensic, psychiatric, or legal aspects. So, you all know nowadays there is a more opportunity or more scope in forensic science. So, in India Lunatic Act, so according to this act, if you are doing any harm or if you are doing any injury to the mental patient, you will be punished and you will be fined with penalty. Okay, no person is having rights to like do any injury or tease any psychiatric patient. That is one, like it is a not like the law is going to punish you if you are going to do that. So and narcotic drug and psychotropic act. So narcotic drugs means like morphine. So some of the patients or some of the people will use morphine drug and narcotic drugs to treat the mentally ill patient. That is also not good. If the police came to know that if you are using any narcotic drugs to provide treatment, then you will be arrested and again you will be punished and you will be fined with penalty. And next one, mental health act. According to mental health act, the mental person have some rights. He have right, like he is not have rights to vote, he have rights to like sit, go in society, he have rights to survive in society. No person is having rights to punish him. So in village peoples, if anybody got psychiatric illness means they will tell to go out from this village. So that is not correct. If the law come to know that, they will punish the village peoples also. Every mental patient have the rights to live in the society. And next one, admission and discharge procedure. So you all know we have admission and discharge procedure for hospital, and same like in psychiatric hospital also there is the admission and discharge procedure. But here the psychiatric person will not get admit and he will not ready to discharge. His caretaker should admit him, and his caretaker only should take him back. Okay, so there are some rules and regulation they need to follow while taking admission of the psychiatric patient. And standards of psychiatric nursing practice. If you are going to become the psychiatric nurse, what are the rules and regulation you need to follow? What are the, like, timings will be different for psychiatric nurse, and some of the rules will be changed. So everything you need to follow. And the next one is rights of mentally ill patient. So what are the rights? So I told he don't have any rights to vote or something. So he has some rights. He have some rights. That rights he can, like, he have the rights and legal responsibility in the care of mentally ill patient. For example, if the mental patient is having more property, so we need to take care of that property also. There is a chance of cheating. Okay, you all seen in movies and some stories that the mental person is having more property, they will take signs and something, and they will fool them easily because they don't have the capacity to judge. So if the person is having psychiatric illness, the government will provide one lawyer to look after his property. That is also one of the rights of mentally ill patient. So the next one,
Here it's going to be wind up the syllabus review. Now we move towards the question paper pattern discussion.
listen carefully because this is very much important. If you don't know how to write the exam, without knowing how to write exam, how to answer the question, definitely you will get failed in your exam. If you know proper way of writing exam and proper way of presenting, then only you will be like passed. So listen carefully what the Swarnashri ma'am is going to tell.
Ma'am, kindly remove the slide. Abhina ma'am, remove the slide. Here we are going to discuss about this question paper pattern. As you all know, we are going to write for the 75 marks. Yes or no? For the 75 marks, we should know that what kind of questions we are expecting. Okay, the question paper pattern, how it is. The first, in first main, what kind of question will be there in the second main, in the third main, and how the weightage of the mark should be there for each and every question. So that should be very important before going to attend any examination. For that reason, you have to listen this session very carefully, especially this question paper discussion. Okay, when it comes to this first main, we are going to expect this meaning of the question. Okay, here we having a four questions. Each question carries one mark. Okay, this is one of the very important main. We can easily score 4 marks. Then after we can go to the fill in the blanks type of questions. Okay, in this question paper only we can expect this meaning of the questions. Then after fill in the blanks type of questions, true or false. Then after short notes and short essay type of questions for 5 marks. And last one is only the question, it is having a high weightage of the marks, that is what 5 plus 3 for 8 marks. Okay, this is what the type of question paper pattern. One by one I will explain. Okay, the first main, as I told that the first one is what, meaning of the question. Okay, when it comes to the meaning of the question, only we need to write the meaning. Keep it in your mind. No need to write one page or two-page answer for this meanings. Okay, only you write only 2 to 3 lines. Okay, the exact meaning of the diseases or disease condition or what the terminology asked by the questioner. Okay, for that reason, you should not spend much more time in these things. Okay, understood? The next thing is what we have to answer for the fill in the blanks type of questions. Okay, when it comes to the fill in the blank types of questions, only one word is needed. No need to waste your much more time in this session. Okay, only you write one word answer. Understood? Ma'am, remove the slide, please. Avina, ma'am, remove the slide. Okay, the next type of question is what, true or false. Okay, here the one statement will be there. There we need to give the true or false statement. The statement is true, you have to write true, or the statement is wrong, you have to write false. That is what you are going to write. Shubha ma'am, continue. The next thing is 1 minute, 1 minute. The next thing is what? The next thing is what? Here we are going to discuss regarding the true or false. Now, only the statement they will give whether we need to answer for only true or false like that. Okay, only few minutes will take. Okay, the next important session of the question paper is what? We have to write the
I'm audible.
1 minute, 1 minute. Hello, hello.
Okay, as ma'am said, some of the like how to write the exam question paper pattern, right? So when you're attending like mean, so for first main you will be asked give the meaning of the following. So for this question you need to write only one line answer or two-line answer. Don't write more than 2 to 3 answer for 1 marks question, and don't waste your time. So majority of students will complain with time, like so they will come, ma'am, I know the answer but it is like I can't take time. So this is the problem what the students are suffering. So what I am telling is, before you are entering exam, first you learn how to manage the time. So for 1 marks question you write only 1 to 2 lines, that is enough. And coming to the true or false questions, don't write the questions, just mention whether the statement is true or whether the statement is false. That's enough. So what some students are doing, they used to write the question and at last they are going to mark whether it is true or false. No need. You read the statement. If the statement is correct, mark it as true, and if the statement is wrong, mark it as wrong. And next, short answer. If you are writing for short answer means it will be like for 5 marks, right? So for 5 marks, write at least 2 to 3 page, not less than 2 to 3 page. You need to write more than 2 to 3 page, then only you can get 4 marks. So coming to the next, long essay. So for long essay, they will be asked for 10 marks, 10 marks question. So for 10 marks question, you need to write more than 8 pages, 8 to 10 pages. Don't write 1 page or 2 page, and you can't expect 8 marks or 9 marks. So if you want more marks for long essay questions, you need to fill more pages. So the next thing is, when you are writing the exam, please underline the words, so you will know which line is important, which is the heading. While you are writing the exam, you need to underline the word, because when we are doing correction, if we are seeing, we can't read every answer like theory. So if you are underlining the words, then it will makes the attractive. So keep in mind to underline the words. And the
Uh,
next thing is, while you are writing the exam, use black pens. Okay, don't use any blue pen or any other color pens. You should compulsory use black ball pen. That is also you need to keep in mind. And the next thing is, first read the question properly. Okay, so when they give question papers, first take at least 1 to 2 minutes to read the question papers. Don't start immediately to write the answers. So 1 to 2 minutes, take time to read the questions properly, then write the question number. So some students are like, they will miss the question number, they will start to write the answer, and the mistake will be like, don't do this mistake. So when you will start to write the answer, first you need to mark the question number, that you need to keep in mind.
Shubha ma'am.
Ma'am,
One more thing I need to inform you guys. You just write the answer. No, wherever you will feel this point is highlight there itself. You just do this
underline the
underline.
word.
Okay, no, yeah, no need to take extra time for doing underline. Later I will come and do. Don't use such kind of tips or tricks. Okay, do it there itself and move on. Okay, to the next questions. Then after this is the things what we have discussed in the question paper discussion, and ma'am already in. Uh, Tell about this answer writing also. If you have any doubt, you just ask now.
If you have any doubt, please ask us.
Ma'am, actually, I'm having one doubt, ma'am. This is Praveen.
Please, please.
Okay, tell me.
Ma'am, am I audible?
Yes.
Yeah.
Ma'am, there are some myths about the writing on essay notes. Like some of the people will tell, like you have to write a number of pages in order to get full marks. And what about writing the flowcharts, ma'am? Like if you just make down small diagrammatic representations of the answer,
Yes,
will
yes.
it be helpful? Will it be helpful for us?
Yes, of
Yeah,
course, it will
of
be
course
very
it
helpful.
will be helpful.
Like
Yeah,
making a
of
small
course.
flowchart of main points and connecting all those things by using a small flowcharts. Will it be helpful for us?
Yeah, of course it will be helpful,
But
because
some of them will
if you are
some of them.
writing like a flowchart, listen, if you are writing like a flowchart, it will attract, and it will like it will look good also. So there we will not take any time to read the theory answer and all. We can
Okay.
give more
Yeah.
marks also. You can expect more marks from these flowcharts.
Okay.
Ma'am, one more thing
Okay.
we need to tell in this. When we are writing the 5 marks or the 8 marks questions, there is a certain criteria need to write the answer. Okay. When it comes to 8 marks questions, first start with the introduction, definition, causes, signs and symptoms. Especially, I told you, no, this disease condition unit will be there. No, from that unit only, 8 marks question will arise most of the time. Am I audible?
Yeah, yeah, ma'am, you're audible now.
Yeah, so for that kind of questions, first we need to start with the introduction. Then after we move towards the definition. Then after causes, signs and symptoms, and management as well. Why nursing diagnosis, everything you have to write step by step,
And
and then
at
after
last
wind up
we
with
need,
the
okay,
wind
and
up
at
with the
last we
health
need to
education.
write role of nurse also, role of psychiatric nurse
Yes.
also. Right?
Yeah, each and every short notes and long essay also you have to include the role of psychiatric nurse. That is very important along with the health education. Okay, this is the way of writing the answer. In between that, you have to use the schematic representation according to your knowledge. Okay, if they are asking about the classification and all, you have to use the schematic representation like flowcharts or tables you can use. If they are asking differences between two disease condition, you have to write the two tables. Then after you can render your answer in that two table with the proper highlighted heading. Understood?
Okay, ma'am. Thank you.
And while you are writing answer, like you have to maintain cleanliness of the paper. Don't overwrite the answer. If you are like, if you are done any mistake, means just strike out. Don't do overwrite everything. And some students will be there, they used to write, this is the wrong answer, please see the next page, page number. Those things no need to write. Okay, it indicates you are dumb, or you are not, you are a foolish. So any other doubts?
Hello, ma'am. Good evening.
Good.
I'm Lakshman. Uh,
Tell
some
me, Lakshman.
hello,
Tell me,
ma'am.
Lakshman.
Ma'am, audible.
Yes.
Ma'am, tell me some important questions.
Lakshman.
Ma'am.
Tell me, Lakshman.
Tell me some important questions, ma'am.
Okay, like some important question, as I said earlier, the important questions like you need to focus on the definition of mental problems. Okay, for example, depression, schizophrenia, hallucination, dementia, then OCD, so anorexia nervosa. So these are the important question for 2 marks. Okay, so mainly focus on the psychiatric problems. What are the mental disorder present? You need to study the definition. Okay, so the next thing, therapies. Therapy is nothing but treatment. Okay, we are using so many therapies to. Ma'am, can you please unmute? Okay, so we need some therapies or treatment to cure the mentally ill patient, right? So you need to know what is behavioral therapy and what is social therapy, group therapy. So these are the therapy you need to focus, and this is also important question. And the next thing is mental status examination. I told you how to do the mental status examination. Mental status examination means we are going to do the observation, interview, and counseling. You need to focus on counseling also. Sometimes they will ask for 5 marks, what is counseling, what is the purpose of counseling. So and the next thing is they will ask what is the role of psychiatric nurse. Okay, this is also very much important. And the next thing, psychiatric emergency. So I told you, right, psychiatric emergency like suicide, poisoning, and making injury to other person. So these all the things also present. So you need to focus on psychiatric emergency and medical treatment, role of psychiatric nurse, and therapies. And like you need to focus on the problems of the mental disorders. Got it?
Yes, ma'am. Thank you.
Okay, next.
Ma'am, I have another doubt, ma'am. Am I
Yes,
audible,
can,
ma'am?
yeah.
Ma'am, this is Praveen. Yeah. Ma'am, in the last model paper, we have came across this concept like what is cognitive behavioral therapy. So could you please explain me what that is?
That has not
Hello.
come to your topic. That has not come to your topic. By mistakenly, that put the DSC slide. Okay, that has not come to your topic. When it comes to this cognitive behavioral therapy, cognitive itself means that the knowledge. Okay,
Actually,
according to the
Praveen, actually, cognitive behavioral therapy is for BSc nursing students, okay? Not for you. And for information, I will tell cognitive behavioral therapy is given to change the behavior of the patient, okay?
Okay. Thank you.
Any other doubts?
Thank you, ma'am.
Yeah, it's time to wind up the section. As we come to the end of this revision section, I want to thank each of you for your active participation and focus. So remember, revision is a very key. So continue reviewing your notes and practicing problems. If you have any further questions, don't hesitate to reach out. Learning is a continuous process, and we all are here to support each other. Thank you once again for your time. Wishing you all the best for your exams. Stay positive, stay curious, and you will do great. Thank you. Thank you so much. Now
Thank
it's
you.
time to leave.
Thank you, ma'am. Thank you.